Hey everybody, and welcome back to the channel. Today we're going to be talking about why your feet are warning you about hidden health problems, and these are 10 signs that most people miss. I have treated thousands of patients with neuropathy, diabetic neuropathy, chemoneuropathy, autoimmune induced neuropathy, and there are warning signs telling you that something else is going on, and I see people just blow these off all the time. So your feet are trying to tell you something, and if you ignore these warning signs, it could cost you your health or even your life. I'm Dr. Strong, and in my practice, I've seen patients whose feet revealed serious health conditions that their doctors completely missed. And today I want to show you 10 warning signs your feet are giving you and about hidden health problems and what you can do for them naturally. So make sure you watch until the end because number 10 could save your life. And I also have this PDF for you so that you can go back and have this with the action steps that you need to take in order to get this addressed. So if you don't know me, then and you're new to the channel, my name is Dr. Strong. I make these videos because my goal is to help as many people as possible overcome their chronic health conditions. So most people think that foot problems are just foot problems, but here's what conventional medicine doesn't want you to know. Your feet are like a window into your entire body's health. As a chiropractor who specializes in helping people reverse chronic conditions naturally, I've learned that your feet often show the first signs of systemic health issues. And the reason most doctors miss these connections is because they're trained to treat symptoms, not look for root causes. But when you understand that your feet are telling you what your feet are telling you, you can catch serious health problems early and address them naturally before they become life-threatening, because I see patients that develop ulcers and infections. It leads to sepsis and amputations, which I don't want for anybody, and this is very common in diabetics. Now, warning sign number 1, I want to go ahead and jump into this, is that if your feet are constantly cold, even in warm weather, this isn't just a circulation issue. It's often the first warning sign of thyroid dysfunction. Your thyroid controls your metabolism, and when it's sluggish, your circulation suffers. Cold feet can also indicate iron deficiency anemia or early stage diabetes affecting your blood vessels. This is what we see in 80% of cases, that they have damage to the microvasculature in their feet or their hands. So what you need to do is to get your thyroid function tested, not just your TSH, but T3, T4, and reverse T3. Support your thyroid naturally with iodine-rich foods like seed vegetables, and consider addressing underlying gut issues that often cause thyroid problems. 60% of your metabolically active thyroid hormone is actually made in your liver, and this is why we see that when you're addressing just the thyroid, you're not going to see very much progress with thyroid problems. You have to address the liver dysfunction and the metabolic dysfunction in order to overcome those. Now, warning sign number 2, I know that this one is very common, is this is my specialty, neuropathy, but here's what most doctors don't tell you, is that numbness and tingling in your feet isn't just diabetes or getting older. I hear that excuse all the time. It's often caused by nutrient deficiencies, particularly B vitamins, or toxic exposure. So I've helped hundreds of people reverse their neuropathy by addressing the root cause, whether it's heavy metal toxicity, gut dysfunction, preventing nutrient absorption, or chronic inflammation. So what you need to do is get tested for B12, folate, and B6 levels, and consider a heavy metal detox protocol and heal your gut to improve nutrient absorption. I have a whole video about the 10 warning signs that your body needs to detox, and I lay out there how to do like heavy metals with cilantro, just adding that in, and warning signs to look for with these heavy metals to get rid of them. Warning sign number 3 is swelling or edema. Swollen feet and ankles aren't just from standing too long. This is often your heart or kidneys crying for help. And when your heart can't pump efficiently or your kidneys can't filter properly, fluid backs up into your extremities. But here's the connection most doctors miss, is that chronic inflammation from poor diet and gut health often leads to both heart and kidney problems. So when they're trying to give you medications for your heart or kidneys, they're totally overlooking other factors that could be, causing the issue. What you need to do with this is reduce inflammatory foods, support your kidneys with proper hydration, and herbs like dandelion root, and get your heart function checked. Calcium Z-score test is the best test that you can get for heart health to see how much plaque you have in your heart. Warning sign number 4 is yellow or thick toenails. I look at feet all day and I see some pretty gross feet. Now, everyone thinks that this is just a fungal infection, but persistent nail fungus is actually a sign of a compromised immune system and often indicates systemic candida overgrowth. When your gut microbiome is imbalanced, fungus takes over, not just in your intestines, but throughout your whole body, including your nails. What you need to do is address the root cause with an anti-candida protocol, probiotics, and gut healing nutrients. Topical treatments alone will never solve this permanently. This also goes back into cold feet. If you have poor blood flow into the feet and you're getting these chronic toenail funguses, what that means is that the immune system isn't getting there to fight that fungus, and you probably have damage to the microvasculature in your feet. So warning sign number 5 is red hot swollen big toe. This is a classic sign of gout. It isn't just about eating too much red meat. Gout is actually a sign of metabolic dysfunction. Your body can't properly process purines and uric acid crystals form in your joints. This often indicates insulin resistance, kidney dysfunction, and chronic dehydration. Focus on metabolic healing, reduce your sugar and processed foods, support kidney function, and address insulin resistance naturally. Warning sign number 6 is white or pale feet. When you elevate your feet and they turn white or very pale, this indicates poor circulation, often from peripheral artery disease, which goes hand in hand with peripheral neuropathy. This is serious because it means your arteries are narrowing, which affects your entire cardiovascular system. What you need to do is support your circulation naturally with omega-3 fatty acids. Exercise just 10 minutes a day is all you need to do. And nutrients like CoQ10 and magnesium. Address underlying inflammation that damages blood vessels. Okay, so we use infrared and red light here in the office and at home as well. We see amazing results with improvements in circulation. Warning sign number 7 is dark spots or patches. Dark velvety patches on your feet, especially around the ankles, is called acanthosis nigricans. And this is a direct sign of insulin resistance and prediabetes. If you look at my video that I posted on yesterday, where I talk about, how to test for if you're at risk for developing diabetes, I go over this more in depth. But your body is really showing you that your blood sugar regulation is failing, often years before a conventional test can catch it. So I gave you just a simple at-home test that you can do. It takes less than 60 seconds to determine if you're at risk for developing diabetes. Now, what you need to do is implement a low glycemic diet, intermittent fasting 2 or 3 days a week, and nutrients that support insulin sensitivity like chromium and alpha lipoic acid. Warning sign number 8 is foot cramps. So frequent foot cramps, especially at night, usually indicate magnesium deficiency, but can also signal potassium imbalance or dehydration. Here's what's interesting is that magnesium deficiency is an epidemic because our souls are depleted, and stress depletes magnesium even faster. And where you get the highest amount of concentration of magnesium is from green leafy vegetables, which I know is hard for a lot of people to eat, but there are supplements that can help with this. So what you need to do is supplement with a high quality magnesium glycinate, ensure proper hydration with electrolytes, and manage your stress levels, which I know can be hard to do, but remember, just take it very slow and implement one thing a week, and you're going to be better in a very short time. Warning sign number 8 is loss of hair on feet or toes. When hair stops growing on your feet or lower legs, this indicates poor circulation, often from peripheral artery disease or thyroid dysfunction. Your hair follicles are very sensitive to blood flow and hormone levels, so they're early warning systems for these conditions. What to do is that you need to support circulation and thyroid function, as mentioned earlier, and consider nutrients that support hair growth like biotin and iron. And I actually have a new product that I'm coming out with for hair growth, and I'm super excited about it, but I don't want to digress from this. Warning sign number 10 is slow healing wounds. So this is the most serious sign. When cuts, scrapes, or sores on your feet heal slowly or not at all, this indicates diabetes, immune dysfunction, and severe nutritional deficiencies. This is how people end up getting infections and end up with amputations because the vascularity is destroyed, they have too much inflammation, and their blood sugars are way out of control. Poor wound healing means that your body's repair mechanisms are failing, which affects your entire body's ability to heal and regenerate. So what to do? Get comprehensive blood work, including your A1C, support immune system function with vitamin D and zinc, and address any underlying infections or toxicities. Now, here's the action steps that you need to take in order to address these. Now that you know what your feet are telling you, here's what you need to do. Examine your feet weekly. We do that because patients are coming in. We're always looking at their feet. Look for changes in color, temperature, sensation, and healing. Get proper testing. Don't just rely on basic blood work. Get comprehensive panels that look at thyroid, nutrients, and metabolic markers. Also find a doctor that can do the Toronto clinical scoring system to measure and see if you have sensory damage in your feet, along with motor testing to see if you're developing weakness. Okay, we catch people developing foot drop all the time. And so by doing so, we are able to prevent them from where they lose complete function of their foot and they start having to wear AFOs or other assistive devices. Address root causes, don't just treat the symptoms. Fix the underlying gut health, nutrient deficiencies, and lifestyle factors. Very important, especially if you're a smoker or drinker. Work with a practitioner who understands functional medicine and natural healing. Whether that's me or somebody local, I definitely recommend that you find somebody that you can trust and that you feel comfortable with. Now remember, your body is always trying to heal itself and communicate with you, and your feet are just one way it's sending you a message. Now, here's what I want you to do. If you're experiencing any of these warning signs, don't ignore them. I've created a comprehensive program that helps people reverse chronic conditions naturally by addressing root causes, not just symptoms. And there's a link to that in the description. So just click that link and I'll tell you more about how I can help. And we'll do a call and see if you're a good candidate, because I can't help everybody. But if you are, I'll let you know the ways that I can. And so if this video has helped you understand your body better, make sure that you subscribe and hit the notification bell, because I'm constantly sharing the health truths that conventional medicine doesn't want you to know. So your feet have been trying to warn you, and now you have to listen to them. Take action today, because your health is too important to chance. And like I said, if you know somebody that's struggling with this, share this video with them. We're getting close to 10,000 subscribers, so if you could please subscribe, like, I would really appreciate it. If you have any questions,